Namaste, delegates. Can we please assemble back into the conference area? Our session begins in 5 minutes.
Thank you so much. Thanks. Sandeep. Sorry, Madan. No? Yeah. Thanks.
Namaste, delegates and distinguished guests. I hope you've had a good lunch and ready for the next session. My name is Manish Bhavnani, and I'm the Executive Committee member at WHEF Australia and part of the organizing committee of WHEF 2025. It is my honor to facilitate one of the most strategically significant sessions of this forum, Achieving Global Health, Access to Affordable Medicines, Services, and Devices. I now warmly invite our esteemed speakers to join us on the stage. Shri Saurabh Mishra, a serial entrepreneur in digital health with several global ventures. He is currently CEO Vyatra, and which is a venture in education. Next would be Dr. Sharad Pandit, founder and managing director of Care24, renowned for his expertise in patient-centric emergency medicine. Mr. Madhusudan Chavan, CEO of Jiva Ayurveda, who has successfully expanded the brand to over 80 clinics and a global telemedicine network. Finally, we have Mr. Vishwa Prasad Alva, CEO, ScanRay Technologies, a pioneer in diagnostics and radiology equipment with more than 30 years of experience in the medtech space. Thank you, and it's a pleasure having you all here. I now hand over the session to Shri Saurabh Mishra, who will chair and guide us through this impactful discussion.
Thank you, Manish. Good afternoon, ladies and gentlemen. I'd like to start the session actually by invoking a very beautiful mantra from the Taittiriya Upanishad. For those of you who know it, please join me in reciting it. I'm happy to present a translation at the end. Om Sahana Vavatu, Sahanao Bhunaktu, Sahaviryam Karvavahai, Tejasvina Vadhitamastu Ma Vidushavahi. May we be protected together, may we be nourished together, may we strive together with strength and purpose, may our learning shine with clarity and light, and may we resolve differences with cordiality. I thought that was a really nice way to open a session like this on healthcare, and a good overall sentiment with which to approach any discussion. So we had quite a riveting session on defense prior to lunch. And I'll just note that the whole discussion around the world at the moment is that should defense be 1%, 2%, 2.5% of a country's GDP? Well, here we are talking about health, which has risen from 8.6% to 10.3% of global GDP. So clearly a significantly larger industry. And per capita spending has increased by over 60% from between 2000 to 2022. The spend is only going to increase further as populations age first across developed countries and then across developing countries. Governments, health insurers, and families worry about being able to, in fact, afford good quality health care in the first place. I have friends across health insurance, CEOs of health insurance companies in Australia, who are openly worrying about whether health insurance itself is going to be a viable industry or not, if they continue to just pay bills, the members' bills. So conversation about reliable, affordable, and scalable solutions, first and foremost, I think for supporting good health, good well-being, and secondly, for treating disease, is indeed valuable. In this session, you will hear 3 such efforts. Dr. Sharad Pandit's Care 24/7 is showing that even something as seemingly complex as emergency care can be done in a sustainable and affordable way. Shri Madhusudan Chauhan's Jiva Ayurveda is a brilliant example of a business model innovation that is bringing an age-old, low-cost healing system into the mainstream through standardization and quality assurance. And Shri Vishwaprasad Alva's CanRe Technologies is doing what so many great Bharatiya businesses have done in recent times, delivering world-class technology at a fraction of global cost. So without further ado, I'd like to invite our first speaker, Dr. Sharat Pandit, the founder of Care 24/7, a healthcare service provider that enables private hospitals around Australia to deliver high-quality, fully staffed emergency department care around the clock. Please welcome Dr. Sharat Pandit.
Thank you. Thank you. Thank you, Saurabh. Thanks for the kind remarks. First of all, let me congratulate the organizers of the World Hindu Economic Forum on organizing such a fantastic meeting, and thank you for giving us the opportunity. I would also like to start by paying, this is a typical, I consider myself local, I'm from Adelaide now, I've been here for the last 22 years, and as is the custom, we'd like to pay our respects to the Ghana community and the Ghana people on whose land we hold this meeting, and we pay our respects to their leaders, past, present, and emerging. Thank you again. Before I begin, I just wanted to sort of a quick confession. If you look at my bio data or my CV, I grew up in India, went to, studied medicine in India, worked in Germany, worked in England, worked in the US, and then landed in Australia about 22 years ago. So practiced in many countries, gathered a bunch of qualifications along the way, but the other half of my time, I'm trying to explain my thing to the immigration officers. So that's sort of been part of my journey. So I grew up in India. Went to medical school in Pune. I come from Pune, and did undergraduate medical education as well as postgraduate medical education in Pune. After that, after finishing pediatric post-graduation in 1987, went to Germany and did a pediatric and ICU post-graduation in Germany at the University of Düsseldorf. Landed in the UK for a little while, and then after that in the US, where I was in Chicago and Philadelphia for another 10 years or so. And then in 2002, I came to Australia. I grew up in a middle-class family. My parents are both teachers. My mother is a teacher. My father is an engineer. And they're both elderly and quite frail today. But their values of, honesty, kindness, compassion, hard work, they have still guided me along my path. And I'm very grateful for that. I completed postgraduate studies, as I said. And then over the years, as you gather all these qualifications and transformations, there have been two things that have been very constant in my journey. And one is my love for a sport, table tennis, and the second one is actually playing the tabla, which is an instrument that many of you know. So those are the two constants that have been, and for some reason or the other, table tennis has carried me through as has been a constant scheme in my life. I can talk about it for a long time, but it perhaps, I'm still playing at the age of 65, I'm still playing, and perhaps that gives the sort of expression, carrying your bat, a different flavor, I suppose. When we play, say, cricket, somebody sort of stops and carries the bat, it doesn't get out all throughout, and maybe that's sort of my journey. I'll probably carry my bat till I probably die one of these days. So, as you can see, it's been ups and downs. What people think my life looks like and what it really looks like are quite different. So it's not been a straight line. It's been, it has had its share of twists, turns, detours, hard-earned knocks. But each expression and each experience and every challenge, every setback, and every unexpected opportunity has made me the person I am today. And I'm very grateful for the lessons life has taught me in the last 65 years. So I think, again, using my table tennis analogy, life's like a table tennis match. You cannot control the spin, but you can control how you react to it. You can control how you respond, your own response. So in my case, whether it's a diagnosis I'm making in the emergency department, or filling out a visa form because I need to go to a different country, or a tabla rhythm that is slightly offbeat, I've learned to stay in the rally, stay present, stay and let karma decide and handle the scoreboard. So my constants, as I've just said, is, my connection to India. My connection to India is quite deep, not just through lineage, but through the spirit of meditation, the rhythm of the tabla, and the philosophy of Karma Yoga. And I very much sort of subscribe, karmanye vadhikaraste, ma phaleshu kadachana, ma karma phala heturbhur, mate sangostva karmani. I very much subscribe to this notion that ultimately it's the practice of Karma Yoga that ultimately anchors me. It's the understanding that outcomes are beyond us, but our main action and actually our job in life is actually to do our duty, and our actions remain entirely our own. So in a world full of uncertainty, and I return to this truth, try to act with purpose and let go of the results and fight peace in the present. So I just now coming back to Care 24/7. So I came to Australia in 2002, and I was a consultant at the local public hospital, which is the Royal Adelaide Hospital, till 2011. And in 2011, decided to take on a new path and decided to go to start Care 24/7, which is a service, which is a provider of entire emergency services for private hospitals that are wanting to outsource their business model. So perhaps it's not an innovation in product as such, but it's probably an innovation in service, which I often talk about. So I've always believed in the model of healthcare that a doctor provides help when it is most needed. And there is no other time to provide good healthcare with kindness, with compassion, and with humanity than during an emergency. And from my perspective, starting an emergency department, having known the challenges, and I'm sure many of you who live in Australia have experienced this firsthand, the challenge, it is about giving people the choice. It is the choice to be seen more quickly than in the Australian public system. It is a choice to be personally treated by a specialist emergency physician when actually the need arises, and the choice to have immediate access to a series of set of networks and specialist networks when it is important. So I think that model has had some resonance in the community. Our numbers in the emergency departments, we see about 45,000 patients across Australia today. And overall, I think our net promoter scores are highly rated. So we are highly rated, rank above 70, which is a very good number. It's much better than the industry average. So what do we do? I think that's the first of the, as long as I think if I can answer the why, the what and the how actually then follows. So the what is we provide specialist emergency care 24 hours a day, 7 days a week when the patients actually need it the most. The doctors are there, specialist ED doctors are there all the time. In all our emergency departments, the patients get seen by an expert emergency physician right away, and who then coordinate their care based on individual requirements at that point in time. So we try to make, this is what we saw, which as our mission statement, we try to make the people's worst day the best they can be when nobody else can. So, as a leaving the comfort of a this is a personal sort of personal perspective, leaving the comfort of a well-paying job to actually start our own business was not just a career move. It was a leap of faith in stepping away from certainty and diving head-on into the unknown. There is a risk, there is fear, sometimes there is the harsh reality of hitting bottom and rock bottom. But here is the truth. The bottom is not in the end, it is in the beginning. It actually causes a transformation. In the depth of this uncertainty, I discover what you are really made of. You adapt, you grow, you build resilience, and slowly the person that was once there is not there anymore, and you become bold and agile and perhaps a reasonably decent entrepreneur. But it is important to remember, in my view, that none of this would have happened to me had I not decided not to take that first leap. And as the Chinese expression goes, journey of 1,000 steps starts with the first one, and the first step is where the journey begins. 。 So how do we do? What do we do? So supplying a full gamut of emergency services that are required to operate a fully fledged emergency department involves just more than being just a doctor or a clinician or on the floor. It encompasses 24/7 medical staffing, putting appropriate traction systems and triage systems in place, having access to advanced diagnostic facilities such as X-rays, MRIs, CT scans, ultrasounds, having access to expert pathology services, having excellent resuscitation capabilities, establishing short stay or observation units, and providing a seamless integration with inpatient and specialty services. In addition to this, it involves having a governance model that is really important so that the checks and balances that are there within the system that ensure patient care at all times and good patient care at all times is very important. And finally, providing administrative and billing infrastructure so that the service can be integrated as a whole. IT plays a big role in our model as a backbone because it plays a very valuable part, and the IT environment can be deployed and a full set of dashboards can be developed for monitoring activity and performance in the background. So all these components together ensure not only timely and efficient patient care, but also a sustainable and high quality emergency care model within the private healthcare system. So this is just an example of a dashboard that we actually create every single day for at the hospitals that we work at. So our model is essentially scalable, and we tailor our private emergency model to align with local requirements, ensuring they meet the specific clinical, demographic, and operational needs of the communities we serve. Whether it is adjusting service scope, whether it is adjusting workforce mix, or integration pathways with local hospitals and specialists, our approach always remains flexible, and we are there to serve the community. So the operation is flexible, it's data informed, and grounded in a deep understanding of the regional complexities of the healthcare landscape we actually work with. And we must be doing all right because we have long-term contracts with the hospitals we work at, and it must be working for them because the Calvary Hospital contract just got extended for another 10 years. So that's been a big positive for us. So we have long-term contracts, and I think it ensures clinical excellence. But far more than that, it's a long-term sustainability and trust in the communication that actually we deliver. A successful emergency department is more, in my view, than just a place for urgent care. It is a high-performing environment where clinical precision meets compassion, kindness, and culture. At the heart of a successful ED is the patient experience. From the moment the patient arrives, we make sure that they feel safe, they feel seen, they are supported. There is clear communication, there is minimal waiting times, and a smooth journey through triage, through treatment and discharge of admissions, and all contribute to trust and satisfaction at every interaction. A strong values-driven culture fuels this success. When teamwork, accountability, and respect are embedded into the department's DNA, the staff perform at the level and they need to perform, and even better, and at their best, even in high-performance situations. So a culture that prioritizes both patient safety and staff well-being fosters resilience and continuous improvement. And we take pride in that development and fostering that culture. Operational excellence is the next thing. Efficiency and reliability are vital in emergency care. This means having well-defined workflows, real-time data visibility, appropriate staffing models, and an adaptive capacity planning, which we always are working at. So operational excellence reduces delays, it enhances clinical outcomes, and ensures that the department can scale to meet including high demand during surges. We've grown from a volume of about 12,000 patients a year in Adelaide to about 21,000 last year, and that must be doing something right. So the operational excellence becomes a very key part of this whole model. And finally, building the strong relationships. I always say this, that emergency department work is like team sport. Success relies on collaboration, it relies on strong trusted relationships, and not only within the staff, but with multiple stakeholders, such as ambulance services, with the visiting medical officers who come to us, the staff that work with us within the emergency department, the wards. So variety of moving parts, and trust and relationship with all these services is really important. And so ultimately, when people trust each other, coordination improves, silos break down, and the focus then finally remains on where it should be, is ultimately patient care. So as you can see, I am a doc in the trenches, still work on the floor clinically, but this is where it is at for me, making sure that the patient stays at the focus of all of this.
Dr. Pandit, we're out
So,
of time.
yeah, I'm sorry. Thank you. All done. Thank you so much.
Thank you. Thank you, Dr. Pandit, and well done on this impressive, affordable, and I think quite scalable business model.
Thank you.
I'd like to next invite Sri Madhusudan Chauhan. Madhusudan ji leads Jiva Ayurveda, a company with over 500 Ayurvedic practitioners, consulting via its network of 80 clinics, and also via phone and video calls. The company also manufactures a proprietary range of Ayurvedic products at its WHO GMP certified facility. Madhusudan ji.
Namaskar. Namaskar and good morning. It's a tough post-lunch session, and I made sure I walked because Swamiji is very strict on timelines, and I thought I should not waste 10 seconds walking up and down. So the previous session was on defense of the country. This is an equally important session because this is also about defense. This is about defenses of our societies from their health point of view. And if there is something that COVID has taught us all, it is that without the health being strong for a nation, no matter how economically prosper it may be, it may come crumbling down at any point. Maharishi Charak said, Dharmartha kam moksha nam arogyam moolam uttamam, which means no matter what you want in your life, dharm, arth, kam, moksha, it is not possible without attaining health. And thereby, healthcare, not just from an economic standpoint directly, because of its contribution, but also indirectly, because without health, none of the other cogs of the wheel will move. I am talking about how Ayurveda as a scalable business can unlock business potentials. There was a Nielsen Global Health Survey done, which said there is a 40% increase in the consumer's preference for choosing things that are natural, organic, preventive, wellness in its orientation. And thereby, I think from a consumer standpoint, there is a clear-cut mandate saying they want to spend less when something is broken and they want to start focusing more of their mind shares on keeping it right. How does Ayurveda fit into this as a scalable health model? Once again, Acharya Charak says in his treatise, Charak Samhita, Prayojanam chasya swastasya swastha rakshanam aturasya vikar praschamanam cha. And then in another text of Ayurveda, Sushruta Samhita, Maharishi Sushrut defines health as sam dosha, sam agnischa, sam dhatu malakriya, prasanna chitta atmendriya mana, swastha iti vidyate. The two verses very beautifully define. The first one says, the objective of Ayurveda is to maintain the health of the healthy, and then next, if something is broken, fix it. So if thousands of years ago, the science was documented, clearly prioritizing wellness as a key priority, which I think in today's society, we are now coming age and saying that healthcare is not just about disease care, but also truly healthcare. This is something which was documented in Ayurveda 2000 years ago. The definition of health, which is the second verse I recited, says health is not just physical attributes or the body being healthy or absence of disease. It says maintaining the right emotional, mental, spiritual, conscious health, all of that put together is health. Very interesting, today mental health happens to be one of the key priority areas of health, and this is how health was defined about 2000 years ago in a documented fashion. So in terms of thought, it's a very advanced science. Sorry, this is not moving forward. Can we move forward, please? Whoever is working the presentations. Yeah. A McKinsey survey says in the last 100 years, we've almost doubled the life expectancy, predominantly on the back of vaccination, reduced child mortality, reduced maternal mortality. However, same report says while we've added years to life, have we added life to the years? We still spend 50% of our lives in less than optimal health, exactly what we were doing roughly about 30, 40 years ago. That's one challenge. The second challenge is the kind of problems that are going to increase in the next 20 to 40 years. The bubbles in gray are non-communicable diseases, which is diabetes, kidney, liver, cancer, respiratory disorders, not communicable, not caused by a virus, not caused by a bacteria. How well prepared are we to handle as a healthcare system? Same report outlines the current medical stack's capability in terms of handling these non-communicable disorders, and if you see all of them stack at the bottom, which goes on to show that these are the problems that will increase in our society and we are least equipped to handle those. And that's where Ayurveda comes in, and I think this presents Ayurveda a great opportunity, not just in the space of wellness, but in the space of chronic care management, where by design, by DNA, and by the very design of Ayurveda, it happens to take care of not just the symptoms of the problem, but the root cause, and thereby looking at diet, lifestyle, nutrition, and the physical manifestations of the disease as a whole. And this is an opportunity we looked at about 25, 30 years ago, and we started solving it. Just to give a context, I'm not sure how well versed are you with Ayurveda as an industry. Basic distinction, there are many traditional health practices worldwide, right? Each region has their own. Ayurveda is slightly different because it is codified. It is a traditional medical science. It is a documented, rational, rules-based body of knowledge. In India, it is very well regulated. There is a ministry established for it. There are quality, safety, regulatory standards that it follows. There are more than 3,000 hospitals and 700,000 registered Ayurvedic practitioners, Ayush practitioners in India. There are 40,000 plus published research papers, which is an open research portal for access. In terms of the commercial growth of the industry, it has gone up from 3 billion USD to 27 billion USD. So a very vibrant sector, a very growing sector, quality-driven sector, and also now moving towards standardization for global scale. The aim, mainstreaming Ayurveda, how do we integrate this as part of the mainstream healthcare ecosystem, and globalizing, taking it from Bharat to the rest of the world. And a lot of work has been done in the last 12 years for it. There is a Heal in Bharat program, which currently the government has launched, and thereby they're promoting Bharat as a wellness, tourism, and medical travel destination. Ayush Excel, which is an export promotion council dedicated to Ayush, is working. Ayush Visa, specifically for travelers wanting to travel to Bharat for studying Ayurveda or take therapies in Ayurveda, experience Ayurveda, there is a special category of visa announced. There are information cells in over 40 countries which liaise with diaspora in that specific region to promote the access and adoption of Ayurveda and Yoga throughout the world. Very proud to mention that the first WHO outpost for traditional medicine has been set up in Bharat, which is also now about to be published are the ICD-11 framework terminologies of Ayurveda included in the WHO's codified system. And this is a big step for acceptance of Ayush systems, not just in Bharat, but the rest of the world where research and collaboration can take place. What did we do in terms of taking this traditional unbroken chain of healthcare practice, one of the oldest? We started integrating different technology-based delivery pathways to make it, one, more accessible, two, make it more rational, science-driven, and affordable, and three, to create a replicable, scalable model wherein Ayurveda is not dependent or accessible in one specific niche island of excellence, but can be accessed by anyone. We were the world's first Ayurveda clinic online back in 1995, and we pioneered the world's first Ayurveda app in the year 2000, which was a project called Teledoc and went on to win the World Summit Award at Geneva in the United Nations. We do about 8,000 patient consultations a day with patients from more than 50 countries, wherein personalized Ayurvedic medicine and care is delivered. In Bharat, we operate out of 90 plus centers, and we've just opened a center in Dubai. We're opening another one in Mauritius in September 2025. In terms of Ayurveda hospital, we run 6 inpatient Ayurveda hospitals, which are fully insurance backed in India. So just like how you avail your insurance benefits with a regular modern medicine hospital, in Bharat, you can go admit yourself into an Ayurveda hospital and similarly access insurance for it. Jivagram, which is one of our signature Ayush hospitals, Ayurveda hospital, has just been nominated as part of the government of Bharat's Heal in Bharat program, where they're going to reach out to the influencer and health key opinion leader community outside Bharat, bring them to Bharat, have them experience Ayurveda through one of these Center of Excellence facilities, and then go talk about it when they go back to their respective countries. We have also launched a very interesting integrative medicine project at 2 big Bharatiya hospitals in New Delhi. One is the Indian Spinal Injury Center, which is a flagship hospital, about 300 bedded, specifically focused on spinal, joint, and rehabilitative care. The second center is coming up also in Delhi as part of a 500 bedded modern medicine hospital. And thereby, there are very strong progress being made on integrating Ayurveda alongside the modern medicine, thereby truly delivering a pluralistic healthcare model where the patient is at the center. Not the pathy, not allopathy or Ayurveda or homeopathy. The patient is in the center, and whatever is best choice of the treatment for the patient is adopted by both the doctors combined together. Sorry, once again, this is not working. Yeah. In addition, we run Ayurveda academies throughout the world in Poland, Japan, France, Lithuania, etc., where we train and provide certification and training programs to people who are interested in learning more about Ayurveda. We have a manufacturing unit producing about 600 various kinds of products, which are retailed all over India. They're also, Bharat also going to US, UAE, and some parts of Europe. As part of the work we've done and how technology has been leveraged to bring in such access and affordability to Ayurveda, one was, like I mentioned, Teledoc. There was Massachusetts Institute of Technology, Boston, and IIT Bharat in Mumbai, IIT Mumbai in Bharat. We collaborated with these 2 institutions as part of the Media Lab Asia project, created this innovative way of delivering Ayurveda healthcare through a digitally enabled model right to the grassroots level. There was a cluster of 10 pilot villages which were completely health dark. And by health dark, we mean no primary health centers, no chemists, and what we popularly in India sometimes call jhola chaps, which are not really doctors, but they go and they practice some basic healthcare practices in the region. None of that. We powered this there, and this went on to win the World Summit Award at Geneva. We published the world's first big data analytics-based research paper in a European journal, some 6.5 lakh patient data set in Ayurveda, based out of which we created machine learning-powered, algorithmic decision-based decision support system for Ayurvedic doctors. This was for the first time where technology was enabling an Ayurvedic doctor while he's consulting. So all the different 6.5 lakh patient data sets, what worked for them, what did not work for them. In similar such cases, in high relief scenarios, which combinations were used to personalize the treatment care pathway in real time for the patients. We've created certain evidence-based protocols where there is data available backing the outcomes that we talk about. One of such, our work with diabetes, roughly 3,000 patient study. We presented a paper at the World Diabetes Conference in Thailand. Happened to be the only Ayurveda paper out of some 2,000 different paper presentations. The Jiva's work in telemedicine has been very pioneering. We reach out to more than 1,500 patients delivering their personalized medication completely through the telemedicine route. 65% of these patients come from tier 3, tier 4 and villages who don't have access to quality healthcare. So the same doctor who sees a patient from New York or London or Japan is next consulting a patient from Barabanki or Churu or Jhunjhunu, which may not have such high quality doctors available to them. This is taught as a case study at IIM Raipur, which is one of very popular and celebrated tier 1 management schools in India. This is the footprint that we've been able to achieve, the impact that we've been able to make, and a small difference in our own capacity. Ayurveda in Australia, I think Ayurveda Australia has been one of the countries in the world that has complementary medicine as a category, and thereby Ayurveda is regulated through the Therapeutic Goods Administration, which is a good thing because at least there is some body we can go to and there is some pathway that one can follow to bring Ayurveda to Australia. There is a vibrant community. I've met some doctors already who are practicing Ayurveda, so I think it is a fertile ground, probably not as explored as it has been so far, and thereby there is something called custom compounding prescription practice here, which is very interesting and thereby can be a route through which Ayurvedic medicines, because they are also personalized in nature, can be brought in through this custom compounding route. There is already a couple of MOUs in place, including the WSU, Western Sydney University, which also has a chair for Ayurveda. With that, I hope in the times to come, the Amrit Kal of Bharat Ayurveda will be the Amrit Kalash. Thank you very much. Sarve Bhavantu Sukhina, Sarve Santu Nirama. Namaskar.
Fantastic, well spoken. And it's thrilling to see this age-old methodology coming into the mainstream. Well done. Finally, I'd like to ask Shri Vishwaprasad Alva to take over. Vishwaprasad ji is the founder and managing director of Scanray Technologies, a medical device innovator producing ventilators, cardiology systems, diagnostic imaging equipment, patient monitoring devices, and more at global standard quality and competitive pricing. Vishwaprasad ji.
Good afternoon to all of you. So from Ayurveda, we are going to diagnostic imaging and critical care devices. Just like how we have Atmanirbhar in India, we have Atmanirbhar Australia, Atmanirbhar Germany. Every country wants to be self-reliant in food, in healthcare and education. And here, to be self-reliant and to have healthcare spread to all, one of the most important things is affordability and cost structure which can cover the entire population. Now we can take cell phone as an example. It was from Scandinavian countries and Europe that most of the communication technologies have come. But it is countries like India and China where the population is high and the consumption is high that the prices of these devices were brought down to affordable levels. If the cell phone was costing $5,000 and the service was $1,000 a month, probably it wouldn't have scaled. Now, in coming to medical technologies, we have just about 8 countries in the world that are pioneered in medical devices. It is Germany because of Siemens, Netherlands, Philips, we have GE, US, we have Japan, we have a little bit of Korea, Canada. China is a recent entrant into the medtech. But rest of the 190 countries are all importing medical technologies. And this is where India played a big role. You know, when it comes to low volume, high complexity devices, India has always been much more competitive than China, whereas when the volumes are high, Chinese products have been very, very competitive and also good in quality. If you come to bringing technology to the masses, it is not just the hardcore technology, it is also AI and ML that has made it affordable and that can spread across the world. You can see that even in India, 80 to 85% of the medical devices are imported, mostly from the developed countries. And most of the countries, including the ones that are in the developed countries category, have a significant portion of import content. Now, what is the advantage that we have with India is R&D, we are about 60% lower cost than the high cost countries. There is a skill gap, and that's why I'm saying 60%, otherwise it's 80%. We at Scanray, we are just about a 10-year-old company. We scaled from 5-member team to about 880 people, 480 engineers. We have plants in Italy, in Netherlands, in US, and in India. And we have been able to leverage the technology. India as a standalone, we have skill set gaps in applications and some core technologies. So as a combination, as a global partnership, there is a lot that can be done. In engineering, which is including verification, validation, regulatory, testing, component engineering, there is 80% cost savings in India. In manufacturing, if it is manual-based manufacturing, it's 80%. If it is automated, still there is 50% cost saving possible. In services, we have 90%, and skills are available abundantly. If you take the primary healthcare devices, most of these things are necessary only when you want to scale. There are simpler technologies that are cost effective and that can compensate for the high cost equipments. But when healthcare is delivered in large volumes and in masses, then the cost is one of the most important things. I can take you through, I think this slide is self-explanatory. Home care, I will just skip the thing, remote sensing. I'll come to this slide. We have an X-ray, which is today about 1,000 rupees per X-ray. If you have an indigenized technology and if you are able to scale, you can get an X-ray done at 100 rupees, which will break even at about 20 X-rays per day. An ultrasound, actually this market price is a rural market price. Otherwise, X-ray is about 1,000 rupees, ultrasound is about 1,000 rupees. At 300 rupees for about 10 to 15 scans in a day, you can break even. ECG for 75 rupees, and you can see the slide here. So the cost that you are, the price that you are paying today can be brought down to very significant levels if you scale the production, if you increase the coverage. Today, coverage is only about 30%. If you bring it to 60%, you have a huge opportunity to bring down the prices of the medical devices. Now, the other so I think these slides are self-explanatory. They have the number of scans per day, the cost, the revenues that are possible. And even in remote areas, about 6 or 7 years ago, we had the Canadian Consulate General visitors with a specific problem that, they have villages with a population of 1,000 people, and they can't afford a full-scale hospital. So they asked us to develop something for remote patient care. The challenge there was that in a village, you have only about 5 to 6 patients coming into the hospital every day, and you can't have all the equipments. And if you take any medical equipment, they have a processing unit common. You have a sensor. If it's an X-ray, you have an X-ray source, you have a detector, and then you have an image processing section. Then you have a patient or a doctor interface. Now, you can have the central processing unit common for all the equipments. You can have an ultrasound, an X-ray, a ECG, a laboratory equipment having the same common processing unit, and only the front end and the user interface can be different. So we devised an equipment which we called a ScanLife DX100, 200. We have some catalogs at our booth there, where we multiplexed all the technologies together, and an equipment which would have cost about 60 lakhs, we brought it in about 7 to 10 lakhs. This means that, with 10 patients a day in a rural hospital, and a telemedicine connection. You can treat patients at less than $2 per person per month. So in an insurance scheme, if you have the scale, if you have a network of doctors in low-cost countries, you have the local doctor in the high-cost countries, the cost of healthcare can be brought, maybe even if it is not $2, it can be brought down to $10 per person per month in a scaled version. So this is where the opportunity is, even for Australia, for Canada, New Zealand, to start with, because of the large, the extent of land and the sparse population. But in countries like India and China, it can bring a lot more people into the healthcare cover. So this is what we have done in Scanray. An imported X-ray machine, which was, I think in 2016 to 17, it was more than $100,000. It has been brought down to $17,000. That doesn't mean that it is made for the Indian market. They are FDA CE marked. They are exported to about 80 countries. And is that a breakthrough in technology? No, we have done a breakthrough in engineering. X-ray was not invented by us. X-ray tube was not invented. And to create this ecosystem, we also acquired certain companies in Italy. We insourced technology from US. We got another R&D team established in Spain. So why is that, we are going from a low-cost country to a high-cost country to create the ecosystem? We have a lot of engineers in India who are software, mechanical, analytical, but when it comes to system engineering, when it comes to application, we still depend on some of these countries to bring us the holistic view of medical devices and medical technology and services. If you take the cost, I think this I already covered. Core technologies, medical applications, I just compared India and China because every time when it comes to low cost, India is always compared to China. But China, as I said, large volumes, they have a huge advantage, both in terms of scale, cost, and quality. But when it comes to low volume, high complexity, there's a huge advantage working with India, even for creating a full-fledged social or public sector healthcare system. I think India is one of the best partners for most of these countries. Mechanical systems are medium, China is medium, the developed countries, I say, is high. In control systems, again, we have medium skills. In polymers, in core technologies, metallurgy, chemistry, we have huge skill gaps that are getting corrected. So the government of India now is focusing on core technology. You can see in the last 2 budgets, there has been a significant allocation for core R&D by the government of India. So in the coming years, you can see some amount of core technology being developed in-house, and which can help even the countries that are partnering with India. So this, I think, I already spoke about it, challenge of innovation. So these are the companies that are there in the MedTech Global, and in India, we have a couple of them coming up. That is it. I think I have still 3 more minutes.
Fantastic. Thank you, Vishraj.
I think I made up.
Thank you very much. It's really wonderful to see.
3 minutes.
Yes, we've got 3 minutes extra to play with. It's fantastic. Well done again for what you've set up.
Efficient manufacturing here also.
Efficient manufacturing, indeed. Well, if I could beg your indulgence, ladies and gentlemen, as the chair of this panel, I thought I might just go first in terms of asking questions. We have about 20 minutes plus 23 minutes of question time. So I actually want to ask a question to each one of you. It's the same question. It's a question that I got asked just last year when I inadvertently bumped into Sri Mohandas Pai at a conference. And how many of you know Mohandas Pai? Yeah, he's a force of nature. I found myself cornered in a room, and he said to me, it's fine, like everything you're doing is great, but what's stopping you from doing 10 times that much in the next 5 years? Tell me, it really sort of pinned me down on that. So I'm going to pass on the favor to you. Dr. Pandit, starting with you. I mean, it's a really innovative model. I've outsourced emergency care in private hospitals. You're already doing 3. There are 400-something private hospitals in Australia alone. What does it take to go from 3 to 30?
So the market opportunities in Australia don't come on that frequently. The outsource model, the organizations that actually decide to outsource their emergency departments have to make a strategic decision to actually outsource. So that is not a space that you can easily influence. We can put ourselves there. There are people who actually go out to covet such opportunities, but certainly that's the limiting factor.
And what about beyond Australia?
Yes, certainly we are open. So that is, we are open to expanding and sharing our know-how and expertise with opportunities come along.
Fantastic. And is it again, the question of what is that one thing that might take you to, from here to 10x? Is it funding? Is it partnerships? Is it identifying the right country? What would it be?
Yeah, I think to some degree all of that, strategic partnerships with groups. We are in conversation with some people just now in Australia that might help us scale up significantly quickly. Funding will certainly follow. The challenge for funding will follow. Currently, we have no debt. We are sort of primarily manage resources within our internal resources. But that will certainly be another step. But I think the first thing for me, from my viewpoint, is actually getting the opportunity to put ourselves in front of providers who want to actually outsource their EDs.
Dr. Pandit, I'd like to share, look, certainly in Australia, funding is a really paradoxical situation. The smaller funding, the lower the funding that you want, the more difficult it is. The larger the funding you raise, the more easy it is. It's a real paradox. So if you really go for that 10x, I think you actually have a chance of getting that funding.
Thank you.
Madhusudanji, what a wonderful thing, 500 practitioners, 90 clinics. What does it take to go to 500,000 practitioners?
So I would say 2 or 3 specific things. One is standardization in terms of both the education, the quality of education and the output for the Vaidyas and the therapists and all of that. And the second is also the practice itself, right? While it is codified, but the standardization, the evidence building, the data, the research, the outcomes, that cannot be produced overnight. It takes a certain amount of maturity within the system to do it. So that is one very key big factor, and which is important in healthcare delivery, right? Everybody wants to know what the outcomes are and what the researches are, where the evidence is. Second, within the confines of Ayurveda treatment services, access to capital. It has improved, even in Bharat. There is slightly better opportunities now in the Ayurvedic product spaces. Ayurvedic treatment services, access to capital would be the second.
I see. Is it again just the fact that it's considered a complementary modality? Is it that?
In Bharat or here?
In Bharat, yeah.
So not just that, I think because they want to understand what is the standardization, what is the data, what is the outcome, what are the liabilities, and so on and so forth. So that. I would say also, I mean, I'm speaking hypothetically on behalf of people who probably are looking at it as an investment opportunity, is there are 2 parts of Ayurveda. There is classical Ayurveda, which is codified, written in the books, and then there is patented products. So probably they favor patented products in Ayurveda more than classical, because classical, there is no moat around. It's probably like a generic manufacturing unit versus the patent held in a pharmaceutical firm.
I think, could you point to Patanjali and say, look, what happened there?
So Patanjali did not access the investors as such, but it probably took a different route, right? However, there are examples within the Ayurveda space of organizations that have accessed both venture capital funds and also capital market funds.
Great.
Yeah.
Wonderful to hear. Vishnu Prasadji, question to you. 800 people, that's an impressive organizational structure. Multiple countries, R&D centers, selling into, but are you selling primarily into Bharat at the moment, or are you exporting as well?
Sell in about 80 countries.
80 countries, all right. I can't ask you to sell to 800 countries because they're not 800 countries, but how do you go from here to 10x?
I think for us, the major challenge is getting R&D people. So the strength of Skanray is people who have worked in core product technologies. We put them together at one place. So about 480 engineers sitting in one place, some in Bologna, some in Spain. But when it comes to scaling, you have to train from scratch because we don't have a competition. When you take pharma companies, I think there are more than 200,000 companies in the world. And then you can poach from somewhere. But when it comes to medical technologies, you have to build people from scratch. And the moment we build talent, the MNCs will poach them. So we will become a training ground for the large companies in hiring people. One of the reasons why we went to Europe was manpower is very stable in Europe and US compared to India. So, the difference again between engineers in India and engineers in Spain or Italy, they take engineering because they love engineering. Here we have a huge set of engineers who have been pushed into engineering by their parents, and they are just looking for a chance to jump to another job that pays higher. So that's the biggest challenge we have in scaling R&D. Manufacturing, yes, it's a low-hanging fruit in India. A lot of manufacturing is getting moved into the country. And it is very illusionary when you say Indian manufacturing is booming because low-end contract manufacturing jobs are coming in and R&D, high-tech is stagnant or sometimes degrowing. So this is a challenge. Money is available, but when you talk of money, the private equity people don't understand medtech because they have not many companies are there. For example, in India, there's only Skanray that is into core R&D. There are others who buy Chinese kits, assemble, take PLI also from the government of India for making in India. So we have a different kind of a challenge managing this sector. But I think if we start a university in-house, like how the Chinese did, a lot of things we can copy from China shamelessly.
Well, I mean that's what all the software companies did, at a big scale in India. So it's a proven model.
Yeah.
Excellent. I mean, I think that's what a wonderful diversity of responses to that one simple question. Ranging from funding to really talent. So I think we've really spanned the spectrum of healthcare challenges in that discussion. We have just over 10 minutes, so happy to take questions from the floor. We have a few hands that have gone up. Yes. Manish, are you regulating who's getting? There are people around. All right.
Thank you. Thanks for a very excellent and thought-provoking session. I just had a comment and a question for the Ayurvedic medicine and the way it should be progressed, particularly to the Western world. The comment was actually we should stop using the word Ayurveda as Ayurveda and then compare it to modern medicine. When you use that word, actually, it almost sounds as if what we do in allopathy is all modern and Ayurveda is thing of past. And I pretty much like the word complementary medicine in that. And I'm an immunologist myself, so I'm an allopathic doctor. But in terms of selling it I really loved your concept of bringing in evidence-based and doing research and then focusing it more about the outcomes rather than selling it as a fringe benefit. But possibly one thing that we could use to our advantage in terms of what we are seeing, especially in the allopathic era, is this whole concept around microbiome and the way that is almost becoming central to the various outcome measures, and even with various treatments like oncology and everything else. And I think Ayurveda, at least from what I learned from my dad telling me, has been heavily based upon that. So maybe we could use that as a leverage, do you think, to actually sell Ayurveda more to the Western medicine in terms of its complementarity to what already is being prescribed in modern medicine?
I'm sorry, what's the
So the question is, really blending. Can you present Ayurveda in, I suppose, allopathic terms? So, and the suggestion is with biomes. Is that a good place to start?
Oh, okay. So because there was a little bit of an echo
Yeah, there's a
coming
bit of
down
echo.
our side, so I couldn't get everything in entirety. But what I understood was the first part of what you said is why did we call modern medicine as modern medicine and Ayurveda is not modern by that logic, and instead of calling it complementary? I think that was the first comment. Yeah, I mean there are multiple terminologies that float around. Strictly by definition, allo means alternate, the other medicine. So by that logic, we should call allopathy as alternate medicine and not the rest of the medicine. But I mean, having said that, for the lack of common terminology and communicating the message across, we use some certain terms interchangeably. Complementary also within its word itself probably communicates that this is not mainstream, this is sort of just complementing it. So we'll need to arrive at that at some point. Second point you mentioned regarding how do we, yes, certainly. I think what is happening with Ayurveda is we need to have the rest of the world understand it, right? Not just the Ayurveda community, not just the Bharatiya community, not just the community that sort of has an affinity for Bharatiyata, but the rest of the world. We get patients from Africa, from Sudan, who have got nothing to do with Bharat, but they just come based on the strength of the outcome of the medical science and the outcome that can be foreseen by them. So if Ayurveda has to go global, it has to go on the back of its merits and not just the belief systems. And there are multiple ways to do it. One for sure, what you're recommending is the allopathic system of, either can be academicians, researchers, and practitioners, and their counterparts on the Ayurveda side. They need to work together and create a common dictionary. One of the things I mentioned was the ICD-11. So this is, at least for the first time, Ayurveda terms are included as part of the WHO's terminologies, so that whatever we are referring to is documented and defined, and that is what it is. So yes, I agree with that point, that there has to be a cross-pollination of what Ayurveda and the modalities refer to.
Yeah, and I think ultimately be able to explain, our diagnosis and our treatments in the other's language.
Right.
Simple, quite simple. Yeah. Next question, please.
Thank you so much. I'm Kapil. I want to congratulate Sharad. We always see like marketing outsourcing, IT outsourcing. You're the first guy in my life I see emergency services outsources. So look like Indian guy can do that unique stuff. Second thing for Madhu, my father is retired doctor from Ayurveda. He did MD in asthma and he cured my cousin's sister asthma within 6 months, and she's all her life she's asthma free. But he never get opportunity to cure other people. And my mother always struggling with diabetes, and my mother herself with yoga, now she is also diabetes free. So we have so much thing, but Ayurveda is still not in the mainstream. In my kids, I don't believe myself on Ayurveda because we don't have that much knowledge. So how we can bring that one knowledge using podcasts and other information so influence people to go towards Ayurveda?
So I hear many anecdotes like this. Somebody will say that my father, my mother, my sister, me, myself, I was terminally ill. Doctor told me I have 3 months, and now it is 3 years and I'm taking Ayurveda and I'm still alive. It will happen when we stop doing it basis anecdote, and somebody can stand up and say diabetes,
On a study of 1 lakh people, 70% people are off their XYZ medicine after a 6-month Ayurveda protocol, and this is what the research have shown. When there are 1,000 published peer-reviewed, in qualitative, high-quality indexed journals, we are able to get Ayurveda published there. This is when it will truly be accepted and adopted in the way and in the fashion that Ayurveda deserves to be adopted. Which comes to my, what I was mentioning as part of the challenge is that knowledge, research, data building takes a certain amount of time, capital investment, research, manpower, talent, all of that. Unfortunately, we are a little late to the game, right? Probably just the last 7-8 years, we've started pushing the Ayurveda mandate in a structured manner. There are neighbors who have been doing this for 60, 70 years now. And we've seen the way they are now integrated in many of the country's healthcare systems far greater than what Ayurveda has been able to achieve. So we need to follow that path. It may take a little time, but that's the way it gets mainstreamed.
Well said.
I would agree 100%.
Next.
100%.
Hello.
Yeah.
Hi. My name is Kalpesh Joshi. I run a company called Vastu Vision. I am from Toronto, Canada. And I just wanted to ask regarding the Ayurvedic thing, that Ayurvedic and Vastu Shastra are all kind of aligned together. So the medication helps human body, and the design of, let's say, the patient room or operation theater or any other hospital or wellness facility will give natural boosting to them, because we align the 5 elements together by having that space in the right direction, like air, fire, water, earth, and sun. So what do you think synchronizing Ayurveda and Vastu will get a better health to the like patient? Because let's say you give a best medication, but the head, like sleeping direction is not in the right way, it might take a little longer time. And it is scientifically also proven that, like, if you keep your head into north, so the north-north ripple and the north direction, according to the Hinduism, like somebody is passed away, we keep their head into north because there is no.
If I can interrupt,
power.
sorry. Yeah, I think we've got the question.
Yeah, thanks.
So I get the question. I am no expert in Vastu Shastra myself, so please take it with that caveat. I have 2 ways of answering it, right? One, most of the Bharatiya Gyan Parampara based knowledge systems, right, be it Yoga, be it Ayurveda, be it Vastu Shastra, even Jyotish, all of that, has come from fundamentally the same source of the Shad Darshana. Ayurveda draws from Sankhya and Vaisheshika as the basis Shad Darshana out of which it is drawn. So I am 100% bought on the fact that there are connections, right? However, when we talk, and I'm convinced that there are impacts and there must be reasons, but when we transcend and we cross that line into the scientific modern medicine community, unless we are able to talk what the gentleman mentioned in a more prudent fashion, we run the risk of also trivializing everything, right? While, yes, I agree, I am sure there must be commonalities and advantages and positivities and probably better outcomes, but let us establish it before we can claim it. So that's what my take on that would be.
Thank you. Now, we've had a lot of Ayurveda questions. Can we have anyone with a question that is not
Hello?
Ayurveda?
Yeah, but actually, sorry to say this. I have a last question on Ayurveda. Please. Okay.
As a chair, can I override that, or?
Yeah.
Do you mind?
I think it will be fair. Well,
Yeah.
we should have other questions.
Yes, that's
we can
right,
connect
that's right.
maybe
Yeah.
offline.
No,
I
this
think
is
let,
very
let,
crucial.
let me, let me assure you that
Answer-
I will get Madhusudanji to
answering
talk
quite
to
well.
you.
Sure.
If you don't mind, please, yes. Just in the interest of equity, we have somebody here who's.
Thank you for a wonderful presentation on healthcare and across the spectrum as well. My question is for Skanray. How does the Australian legislation and obviously the warranties that are required impact on the access of your product into the Australian market? So we've seen your projection costs, versus Bharat. versus the costs here in Australia themselves. So, how does the impact of legislation and warranties affect the deliverance of your product? For instance, as a medical practice, if we choose to use your products, companies like 3M, Siemens, are integrated into the healthcare culture. If we choose to use you or anybody else, what is the impact of Australian legislation? Thank you.
As I told you, we sell in about 80 countries, and today regulatory is a very hot subject in the Indian, discussions. The trade barriers, tariff wars, and regulatory are somewhat connected. There is a very strong belief that tariffs are sometimes implemented slyly through regulatory bodies. But in fact, I think there is some truth in that, but in reality, the basis for medical equipment regulatories is coming from the European standards, the IEC standards. So once you pass the IEC standards, FDA is 510K route is for filing if it is a equipment that is already available, and another route if it is a innovative product. So coming to Australia, we have not had challenges of regulatory bodies or a barrier to enter Australia. Cost structure, yes, we can actually make a very big difference to the Australian healthcare sector by being here. The only reason why we didn't focus is, we are a 10-year-old company, about 12 years, and we had a bigger markets to tap. US is a very big market, Europe is big. We tried to set up a manufacturing unit in Australia about 3 to 4 years back. We had a partner who is from a automotive manufacturing sector. But Skanray itself has a big flaw. We are all R&D people. Out of 800, I think a big majority of us are from research and development. Marketing is less. So if you partner with somebody who is a technologist here and weak in marketing, we thought it's not a good idea, but we have a plan. And I think when we will come with a bang in the mass wellness sector, and we'll make it affordable. Otherwise, I don't see any challenge.
Thank you. Well, ladies and gentlemen, it's been a riveting session. I really thank you for your attention. We've come to the end of our time. As I hand it back to you, Manish, I presume you will encourage our audience to give a big round of applause to our speakers.
Absolutely.
Thank you. But Manish, before I hand it over to you, sorry, I just wanted to say you missed a trick. Hindustani classical vocalist, a tabla player, we could have done something else here too.
I'm a very beginner flute learner myself. So.
Flute as well, there you go. Vishnu Prasad ji, anything from
Tabla.
you? Tabla as well. We could have had a very different kind of...
If there is a break, we can practice.
Rakesh, namaskar.
A big round of applause to the speakers. I think this was a fantastic session. One takeaway, Madhusudan ji used the term defenses of society, right? And it's great to see each one of you creating world-class products and services within the healthcare domain. And we honestly hope you achieve the scale and prominence you deserve here in Australia and globally. So thank you for all the enlightenment and the insights. On behalf of WHEF 2025, I extend heartfelt thanks to you as speakers for sharing your valuable insights and addressing global health challenges through affordable innovations in medicine, services, and devices. We now take a short break, ladies and gentlemen. It would be a short 10-minute break before we dive into our next engaging panel, and it's called Empowering Through Education,